ഇവിടെ ഒരു അതിഥി വന്നിട്ടുണ്ട്. Mr. Ashokbabu Raamya is here from Kennedy Root Dental, Brampton. Welcome to you, sir, to Madhurageetham.
Thank you for having me here today.
നമുക്ക് അദ്ദേഹത്തിന്റെ അടുത്ത് ചോദിക്കാം കാര്യങ്ങൾ ഡെന്റൽ റിലേറ്റഡ് ആയിട്ടുള്ള കാര്യങ്ങൾ ചോദിക്കാം. Sir, first of all, could you introduce yourself to our listeners?
I'm Dr.Ashokbabu Raamya. I'm a dentist who's been practicing in Brampton for more than 13 years now. But we have a full service practice in dentistry. We cover from anywhere from general dentistry, doing dental implants, Invisalign braces. And recently I've done some advanced training in TMD, orofacial pain. What is TMD is like temporomandibular joint disorders, which is about the jaw joint. There are very few dentists in Brampton or Peel region who have experience in this. I've taken that training and also I've done masters in health professional education along with this in the last 2 years from University of Rochester. I'm here to give some information about it. If you have, feel free to ask me.
Yeah, so TMD, that is something new. I mean, we haven't heard of that particular acronym in the dental side of it. So could you tell us more about what TMD is?
It is nothing but a jaw joint. So we have jaw joints which is located in front of our ears on both sides. That's how the jaw functions when you open and close. Now, this is very unique about human joints in comparison to other joints, where the maximum loads has been taken on a daily basis, where we use most of the time.
Right.
We always pay attention to other joints, but this joints, no one, I should not say no one.
It's pretty much taken for granted.
That's right. So for chewing, eating, talking, whatever. So this is something every single person in this part of the world should pay attention to, same like other joints. We see patients coming in with complaints about, but many times, unless the symptoms comes in, nobody jumps into play to treat this joint.
Right. So talking about symptoms, what are the general symptoms for a TMD disorder?
So most common, before I go with symptoms, I should say there is 5 to 6% of the population in North America experiences problem. Now, I should not say problem, which is symptoms. You know. Now, the basic complaint what we hear from patients is, oh, I hear some joint sounds, joint clicking, popping noises. And there are some comes and say, I have pain as well. There are few others say, I have difficulty opening the mouth and I have lockjaw. I'm not able to open the mouth in the morning, or when I go to bed, I'm having difficulty closing my jaw. And apart from that, they also experience ear pain, headaches, neck pain, so which is all related to this joint. But I won't say all patients having neck pain is because of this.
Right.
But the possibility of having neck pain and headaches, it's because of this.
Could be this.
So
right.
Many times we come across patients saying, I experienced headache, I went to doctor, but my headache still not going away. There are times we have seen patients referred to us by physician and other specialists saying, okay, this patient looks like it's a TMD problem.
Right.
Can you please evaluate and let us know?
Right.
So then when we go ahead and treat these patients, they will really, be happy after the treatment because their headache or neck pain or jaw pain, whatever, it gets rectified.
Right.
Okay, I have a question because we all go to the dentist and you sit there for a few hours. If there's a cleaning, and sometimes even mine actually locks. I can feel it if I open my mouth and close it. There's a popping. And is that related to that?
Yeah, it is, because you see, it seems like any other joints. This joint has a small piece of cartilage, which we call it disc. It's like a bow tie. That disc, when it's shifted from its normal position where it was supposed to be, now you're going to have interference in opening and closing. When that happens, obviously, you're going to have difficulty in opening and closing, which will cause some noises at the same time. Eventually, it will cause pain. Now, depending on where it has been dislocated, we call it disc displacement.
I see.
So when that happens, you can have either just noises, pain, or you can eventually have lockjaw. And there are sometimes patients says, oh, I had this for in the past, now it's not happening. Because it's same like any other joints in the body. This will adapt to the dislocation, and then the joint will again function normally.
What are the causes for this particular disorder? Is it excessive, I don't know, chewing or talking, or is it?
Good question. So the most common is patients saying, I was eating a big bite and now it started hurting. So it can be due to your daily chewing habits,
right.
And it can be due to trauma. It can be due to your bite, meaning occlusion. Nothing is proven saying that it is only because of this. And also, there are times some treatment which is being done by dentists that also can cause, because let's say you go for a dental filling, and if you not have that filling level, then you continue to chew on the same teeth, so your teeth is not balanced now. So then that is going to cause impact on your joint. So there are many causes there. Apart from that, hormonal changes and any other medical conditions can cause this, but most common is hormonal changes. And then women, and the most important point is women are more affected.
Is there any particular age group that faces this challenge?
It can go from anywhere from age of 5 or 6. I've seen my youngest patient is like a young child who was 7 years old in school, and she had clicking, popping on both sides, and she was very much worried, and then she had difficulty opening also later.
Do you recommend any lifestyle changes or anything just to prevent something like this?
The basic thing is like daily routine basis what you should do, your chewing habits and home care, whatever you should do. Basically, I would say there are children, they chew gum every day.
Right.
Which is,
I was just about to ask you that. Is that going to cause a
if you ask me whether everyone should not do, I won't answer that.
Right.
Because it is not everyone is going to have impact on this, but it is try to avoid as much as possible not chewing every day, and also chewing sticky food, also chewing big bites like Big Mac or whatever, big burgers. So the more you do on a regularly basis, that is going to impact your joint. But how many of them looking for treatment? Is, as I said, it's only 6 to 7% of the population, because they are the one who start developing symptoms, and thereby,
Because it's very interesting that you said you can have a headache because of this.
Yeah.
Who in the
would
world
think of that exactly?
Would think about a headache because of a jaw issue?
So how do you treat these patients that come to you with TMJ? What do you recommend? Like, what do you give them?
There are various treatment modalities here, but the most common we start with is, we call it palliative care, which is home care. The simple home remedies they can do, like that way they can overcome. And apart from that, physical therapist is mainly involved in this, where because there's two components there. There's muscle component there, there's skeletal component there. So when it comes to muscle and also in terms of skeletal component, because there's a soft tissue involved in the joint, physical therapist has a good role in relaxing their muscles and joint. Apart from that, we give something called mouthpiece, which we call it splint.